Hi, I'm Jeff Schaffner, and I'm here in Pasadena, California to meet Rigo Garcia, our 2025 Health Equity Torch winner. Rigo has spent the last 25 years of his career dedicated to advocating for those with chronic and rare conditions. Rigo took the lead to transform support through cultural inclusivity, advocacy, and holistic care approaches, particularly for Spanish-speaking communities affected by bleeding disorders, which made him an ideal winner for the Health Equity Torch Award. Let's go meet Rigo. What does it feel like to win a 2025 Torch Award?
Well, to win a 2025 Torch Award is very humbling. I think one of the biggest things that I have learned, especially in the bleeding disorders world and really in public health, is that it takes a village, and even though I've received this award, I wouldn't have been able to do it without my staff. My staff are amazing. My staff have done a lot of great work, and we're an amazing team. And I think that's what makes hemophilia and the bleeding disorders world so unique, is that we're truly a family.
You've accomplished so much in your career as an advocate. How did this journey begin for you?
Well, this journey really began prior to coming to the hemophilia world. I worked in public health and worked in community clinics. During community clinics, a lot of what I did was health promotion, disease prevention, community programming, and it was really focusing on those that needed an extra hand. There are so many people that need so much, and in different aspects of healthcare. It might not just be insurance-wise, but it might need access, or they might need medication or whatnot. Being in public health, this was the area and the focus that I was working on. So in doing so, I really learned a lot about different aspects of healthcare.
We often talk about the importance of innovation to impact patients' lives, but that innovation is only good if it reaches the patients in need. Can you tell me about Familia de Sangre?
Yes, so Familia de Sangre, it's our nationwide conference that's fully in Spanish. We're not only just focusing on a bleeding disorder or hemophilia, but we're really focusing on the whole family and the really whole person care. I bring in that public health aspect. Familia de Sangre was set up so that we had programming for the Latino community, and more importantly, the Spanish-speaking Latino community. Many of our community members are monolingual Spanish speakers, and what we want to do and what we've done is provide a platform and a location where they could come together. There isn't any type of education or promotion or programming that's really focused to the Latino community. Having it be in Spanish, they don't have to put on the headsets. There's no translation that they have to come through. There's not information that gets lost. So they're hearing it in the language that they understand, the round community they understand. And we're Latinos. We love to have a fiesta wherever we can, and just celebrate. And that's what Familia de Sangre is. It really is a celebration and a coming together of the community.
How did your experiences with hemophilia shape your views as an advocate for patients with other rare conditions?
When you're working with various different chronic diseases, there are so many things that you're advocating for, that you don't even know where to start. When you're focused on one chronic disease such as hemophilia, we started to really see what is it that we need. It's a really focused chronic disease, and the focus has really helped me learn a lot about the different aspects, not only with medication, but with access, just like I mentioned earlier. You really do have to become an advocate, because since the group is so low, there aren't very many out there. So being in hemophilia has really helped me learn what are the specific needs with our rare disorder, but then from that assist other diseases.
What lessons have you learned with Familia de Sangre and breaking the language barriers that can improve access for patients in other rare or chronic conditions?
To be able to speak to someone in the same language, I think that's amazing, but it's very difficult. And I think that goes with a lot of different rare disorders. We don't have very many specialists that focus on rare diseases. And even to find one that speaks the native language of the community that you're trying to serve, there are a lot of great experts. We have a local expert that focuses on von Willebrand, for example. But what we need to do is that we have to have translation services. So it's trying to really make sure that we get innovative. It's trying to make sure that we try to think out of the box when we're thinking about this. And it's really trying to share those resources when we do find someone that speaks Spanish.
What advice would you give to an advocate just starting their journey?
I think one of the biggest things for anyone who's just starting their journey is not to get overwhelmed. One of the things that we think of with advocacy a lot of the times is a big picture, you know, going to Washington, D.C., talking to our elected officials. But there's things that we can do at home, advocating for your family, for your child. There are so many times that we see this with a lot of families that they don't want to tell their other family members that they have a bleeding disorder because they feel that they're going to get treated differently or, you know, not invited to things or whatnot. And I think that's where advocacy really starts. And I think so many of us are advocates, but we don't know it because we think that advocacy is always on the government level and not, you know, something that starts at home and starts small. I've been in this position for, you know, over 3 years. I've learned a lot. I've learned a lot quickly. I've tried to learn as quickly as I can. And one of the best things about that is being able to bring in new things to the bleeding disorders community, to bring in new things to hemophilia. And with that, being able to be recognized. So for me, it's very humbling, but very grateful.